All right, you guys, it is 9 a.m. We're going to get started. My name is Lee Washington. I am the director at DJJ here in Carroll County. I'm also the chair of this meeting. So everybody, please sign on the chat when you come in. So we have a record of who's here. And thanks everybody for coming. Remember, we're always on the third Tuesday of each month at 9 a.m. If you know somebody else that needs to be part of this meeting, please let us know. And ask them to register. And we need to get a date for November because the 21st falls on the same week as Thanksgiving. So we know the schools are out and that's a busy week for everybody. So I got a few announcements to make and then we'll go on to our guest speakers this morning. The QPR training, which is about suicide. And mental health and the youth mental health first aid training, they're both online. Is that correct, Ms. Gila? And if y'all can register for those, if y'all need them, I know that I'm having my new staff register for those. The rest of us have had it. The QPR training is excellent and it's much needed because if you don't know how to see the signs and question them and try to get them some treatment, we could lose them. So
could you place that that link in the chat, please?
Ms. Gill will do that for you. I don't have that
Thank
ability.
Yes,
Thank you.
and one of the things that I wanted to mention is that this training that is going to be happening this Thursday, the 19th, is completely full. 38 people registered, so we are scheduling another one for February, and
Okay.
I'm going to send you that link and everything so everybody can start registering for those.
That's great news. That one's full. And if it's full, we'll have probably we got 37 or 38 done, we'll probably get 30 to show up, I hope. So that'll be great. But I think it's easier online because you can do it from your desk. You know, it's hard to get out and about sometimes because everybody's so busy. Ms. Gill, if you're ready, we'll go into the guest speakers. Do you have anything else you want to say before we start that? Okay. So January is Poverty Awareness Month. And our guests work with more vulnerable community than that have no home. They will talk about homelessness, the hidden homelessness, generational homelessness, and what they do to help our community and what we can do to help. From THS, the Holly Spirit Emergency Shelter, Miss Cheryl. I'm just going to say Miss Cheryl because I want to make your last name up. Please unmute yourself, ma'am, and let us know what we can do to help. We can hear you now.
Okay, great. Thank you. Well, I'm Cheryl. The last name is Lankenau, but we just stick with Cheryl.
Thank you, because I wasn't gonna mess that up for you. So
yeah, no problem. I'm used to that. I'm here to just offer some quick comments. Gila asked us that we just say a little bit about our agency and just offer some quick thoughts about the issue of poverty as THS deals with it. And Gila, there is a handout that just summarizes some of the points we wanted to make. So Gila, do you have that? Okay. So this is who we are. And if there are questions or thoughts or comments in the future, our phone number and our email is there. I did put up the mission statement that our focus is serving and assisting those experiencing homelessness. So serve is, those two different words are important to us. Serve means we try to put minimal expectations on the client. We just want to show them God's love and hopefully draw them into wanting to know more. So the serve is to for those individuals that want a more in-depth, long-term relationship with us and who we guide more formally toward getting jobs and being financially independent, making better decisions to improve their circumstances. We are in all, and I'm not going to go through all those points. You can see that we're been around since 2014. Our focus was on group activities or programs primarily for winter sheltering. Since COVID, that all changed. So our relationships with our clients are mostly through email, text, and online registration process. Occasionally, we are by appointments able to meet with our clients. We often refer to them just as guests, and our volunteers sometimes will go out and connect with them in the community. So our current ministry really focuses on motel sheltering. We do other things. We can do rent, we can do utilities, we help with IDs and so forth and so on. But we try very hard to work with other agencies who are more focused on those areas. So talking about data in particular, we've long known that there are different estimates about poverty and homelessness in Carroll County. When we rely on the US Census Bureau data, we get estimates of about we get estimates of a total population in Carroll County of about 122,000. But our own Carroll County Community Development, mostly through Janet Hyde when she was active in that, suggests that there may be a higher percentage than those estimates, a higher total population than those estimates, and that the estimates of poverty, meaning those that are at or below the national poverty levels, officially it's about 16%, but other estimates, especially from our community development, is closer to 20%. That means we have about 22,000 individuals in Carroll County at or below national poverty level. Now, whether we're using percentages of 16% or up to 20% of our population being at poverty, the typical acceptable estimates for Georgia is about 14% at the poverty level. Nationally, it's at about 12 to 13%. So Carroll County has a bigger issue to deal with. Information about the numbers of homelessness in Carroll County vary greatly. We suspect that these are inadequate reporting. Nevertheless, the state level point in time data collection provides some estimates. And the latest we have right now, we don't have 2021 published yet. So the 2019 data suggests that there's about 91 homeless persons in Carroll County, 42 unsheltered, 49 sheltered, meaning homeless, but on couches in motels. We suspect these are sad underestimates. And that's open for discussion. I think we all know that we don't think these are adequate estimates. One of the things that that THS is really interested in is meeting the future needs of those that are experiencing homelessness or other critical financial needs. We'd love to see some sort of one-stop services building program, shelter, where there are multi-levels of both sheltering, long-term, short-term, temporary sheltering, where we can provide 24/7 supervision and support, assist people in navigating government programs, connecting with other agencies. And there are efforts to bring this about. Last year and a half or so, Kathy Parsons has helped the community with a warming shelter in severe weather. And Community Foundation of West Georgia has the building a coordinated system of care effort where they are looking at assessing the nonprofit services in the county looking to see how we can better coordinate those services. And Kim is very eager to get this information out there, and anybody who would like more information about this coordinated system of care is invited to connect with her directly. Oops, sorry about that. So Gayla indicated that one of her primary interests is that we just get a discussion going. So our interest was just providing some points to start that discussion. Gayla, is there anything else you wanted to have focused on, or?
No, I think that you did an excellent way of introduction and everything. And we would just want to hear from Impact West Georgia. And then we can actually have a conversation and, questions and answers, Q&A.
Thank you so much, Ms. Cheryl. It's a lot of information to take in. Miss Kathy, you're up, hon.
Okay, well, I am Kathy Parsons, one of the founders of Impact West Georgia. We started, we received our 501c3 in 2005, but we actually started Impact West Georgia. The very roots of us began in the back of a fast food restaurant in Noonan in the late 90s, where we taught English as a second language to speakers of other languages. But in 2005, the city came to us, wanted us to consider opening a shelter for men. And that's kind of how it all began. So we got our 501c3 status, and we're given a building that we had to tool in order to handle a men's shelter. We moved our English classes here to Carrollton, and it's just been history ever since. In 2008, we opened the first Hope Center. In the meantime, though, since then, I have a whole talking thing that I could bring that says to you, that says, and then God, because about every 2 years, God did something miraculous within our organization. So we have grown from starting in the back of a fast food restaurant to a multi-facility organization now. We're still a small nonprofit, but we do big work. And we work in 3 areas: homelessness, veteran services, and education. Our biggest initiative, though, is homelessness. Not only do we do Hope, but as Cheryl mentioned, we picked up the basket of doing the warming centers last year because I was sitting in my home all fat, sassy, and warm when it was going to be 7 degrees in Carrollton. And having worked with homeless for years now, we knew many of the homeless, and I just couldn't stand it. And so my heart was just broken for that. So we just start, and we have collaborated closely with Laddie and Cheryl and Denise and the people of THS shelter, learning from their expertise, having been the ones who did it originally. And it's just been a blessing. God's hand's been all over that. And our dream is to have a permanent emergency shelter, community shelter in Carroll County. That's the dream. Besides Hope Center and the warming centers, we also do encampment outreach. Going out to an encampment is where they're living in tents or just living out in the woods and in various places. These encampments move around, so you don't always know where they are. And once you find an encampment, or people find an encampment, they often pick up and move. Because they don't want a lot of attention. But we do take homeless mats and food and blankets and things like that out to the encampments when we do an outreach like that. We've had a lot of success with that, with the city police department, the mental health advocates, and individuals coming and getting those mats and taking them out. Now, we also do veteran services. We got a sizable grant from Trinka Davis back in 2012 and bought a large GMC van that we had retooled, double wheelchair accessible. So we give all Carroll County veterans free transportation. Everything we do is free. We're a faith-based organization. We don't charge for anything. But free transportation to and from their healthcare appointments at Trinca Davis, Tanner Medical, doctors. And now we have increased those services to include a day where we pick them up and take them to the grocery store and take them to get haircuts. We're always looking for services that no one else is providing that we can provide for the most vulnerable in our community. And that includes a lot of our veterans who would love to be at Trinca Davis or be able to have access to their medical care. And we think they deserve that at the very least. And so we would like to increase that service into Hurd and Haralson counties as well. There's about 2,000 other veterans who would like to be taken care of here at Trinca Davis. So we are looking at buying a much smaller, more lighter weight van to go into Hurd County first to transport Hurd County veterans, because we are Impact West Georgia, not just Carrollton, and that's part of it. And then our last division is ACE. It's Adult and Community Education. We teach adult reading and writing. We teach English as a second language. We have a Cool Kids Club that fosters the love of reading in at-risk children. We do story parties with them. Every time we have a story party, every child gets a brand new book. Our next book, the last two have been Dr. Seuss books. This next party coming up in March is going to be Charlotte's Web is the book they're getting to take home with them. And we have character come and kind of lead that party for us, read them stories, play games. We had a Easter Bunny last spring. We had a Scarecrow in the fall, and this spring it's going to be a princess. She's going to kind of lead that story party for us. And so in adult and community education, we also do adult reading and writing, and we do workshops like how to avoid the title pawn trap, get that job, keep that job, money smart. We have partnered with Bank OZK, and a lot of people, especially those who have been in jail or they have a felony, they don't think they can get a bank account, or they don't know how to navigate the system, and so they're going to come and show us that, yes, you can, and here's how, and help people, because our men, especially our Men of Hope in that program, and it is a program, not really an emergency shelter, to take them from where they are to where they want to be, they have to save 95% of their money, because we provide everything they really need. 3 meals a day, food, clothing, it's minor dental. We do get their books, their IDs and things like that with them if they don't have them. It just depends on where they are when they come to us. If you come with ID and a vehicle, you're way ahead of the game. And so we do those kind of workshops. We haven't done any since 2019 because of COVID, but we are picking up that this year, and we're starting a new program called Woman to Woman. And basically that's under our education umbrella, where women will come and just be women, be in a safe place. There are a lot of things, like there's a book called Messy Living, The Messy Life, Life is Messy. I can't remember exactly, but we may read that book and just talk about how messy our lives can be in a very safe place, and just share things with each other that we wouldn't be able to share anywhere else. And everything that happens at mom to mom, mother, or woman to woman stays at woman to woman. And so this is a brand new initiative for us, for women of all socioeconomic levels. But when I talked to Gila, she spoke to me about this being about poverty, I did do some research too, and I went into the census and tried to get the latest statistics for our area. And one of we all know we live in an unaffordable housing market. Let's just face it. There are no, we used to be able to get men in and out of Hope Center in 90 days. Well, they're barely getting started in 90 days now. We're taking every case by case. We have a huge waiting list for men to get into Hope, because you can't find affordable housing if you don't have a really good income. And now you even have to pay to apply for an apartment. And you have to, your apartment can't cost, or your home can't cost more than a third of your income. So if you're making, if, well, let me just say this, a medium gross rent in Carrollton now is $1,163 a month. That's the median. So you have to be making well over $3,000 a month to even think about that apartment. Well, a lot of those that live in poverty, they're not making anywhere near that kind of money. So if you're making, if you're a minimum wage person, there's just nothing available. So you have to be kind of creative in finding housing for people like that, multiple families in a home, or multiple people in a home. You share, like you have roommates, so that you can afford what you can afford here in Carrollton. And so the median household income in the United States is $69,000, a little over, but in Carrollton it's 44,000, and that's the median income. That doesn't bring into play those who make far less than that a month. And in Carrollton, the statistics on the census say that we are 32.9% poverty, and that are living at or below poverty level. That's a horrendous number. 30, and that's, you can find that on the census website. And Carroll County is only 16.3. I was shocked by those statistics, just to be honest with you. But the national average is 11.6% of people live in poverty, and Carrollton City is at 32.9%. That's just an outrageous number. And you can find that. You can just go to the Census Bureau and online and see that. The average income in Carrollton, though, is $26,000. It's a little over 26,544, and US it's 37,638. So if they only make $2,000 a month, they can't afford anything over $700 a month. And then that's still really tight. If they have a lot of times people living in poverty have other issues. They have health issues, physical and mental health issues, educational, they're at an educational disadvantage. And so all that being said, we live in an environment here in Carrollton right now that is, well, it's just scary. So we need to do everything we can to help people. Now, I have said we're homelessness, veterans, education. That's our umbrella. And we want to focus on those areas. But every now and then something comes by that really that is outside our purview that we cannot avoid. And that was right before Christmas. We received 3 pallet loads of brand new clothing, all different sizes, kids, adults, men, children, brand new, still had the tags. Now, we're not in the clothing business, and promise you, we don't want to be. But I couldn't avoid that. 3 pallets of brand new clothing. So we took it, and we had a free clothing giveaway here in our parking lot. And we had people, you couldn't stir them with a stick. It was like an ant bed. People just came from everywhere. They were crying, saying we would not have had Christmas without this. Those little things that take us out of our comfort zone, I think we need to really take a second look at those like we did. Ordinarily, we wouldn't touch clothes with a 10-foot pole. It's just, if you've ever seen a clothes closet or been in a clothes closet, it's very labor intensive to keep it, to keep it organized and straight. But we thought, no, this is a 1 in, 1 out, unless somebody else offers me more pallet loads of clothing, and then we'll do it again and again. But we gave away every single thing we had but 4 Mountain Top Design red t-shirts. Everything was gone. Shoes, everything, undergarments, everything from babies to adult men. So I think I know that Open Hands up here does a free yard sale every now and then, like once a year. So we have a lot of items that we're going to take up there when they do their free yard sale for them to give away to people at need. So while our main focus, and we are trying this year to be even more focused because we really want that permanent shelter We need that permanent shelter. Putting that up and down, Cheryl knows as well as anybody how labor intensive that is, and to have a place to store all the cots and linens and supplies and then getting all the manpower that you need. So we would love to have any of you join us in our efforts to impact West Georgia. We're always looking for volunteers. We use the stew out of interns and students at the University of West Georgia. And we're just delighted to be here, and thank you for having us.
Thank you, Miss Kathy. Y'all doing good work over there and have for as long as I've been out here. I've been here almost 20 years now. So, when I
Thank
first
you.
came out here, y'all were just getting started too, because I started in 2005. So I've really seen y'all grow and expand, and what y'all doing for Carroll County is amazing. And anybody that lives in this county, which I do not, I say I do, but I don't. Anybody that lives in this county knows that this community shows up and shows out every time. If you need something, it just appears out of nowhere sometimes. I don't understand it sometimes, but it's a great community to live in. Does anybody have any questions for Miss Kathy or Miss Cheryl?
Hey,
Yes, ma'am.
I had a question concerning the encampments. Kathy, where have you seen the encampments lately?
Well, the very last one we saw was right there beside Goodwill on that strip of land. They were on the other side of the fence on the bypass side. It is
Mhm.
now gone. We
Yeah.
took pictures of it. There were several of them there, and we took some as discreetly as we could some pictures of it so that people would understand what that looks like. Now, I was recently told there's another one right there, but farther down, not quite up next to that. And there's we have helped some people behind Bell's, I think that's how you pronounce it, over where Lowe's and Walmart is,
Mhm,
but
Okay.
kind of behind there.
Yeah.
We've helped a couple of people there. There is, this is not exactly an encampment, but an individual who camps out up on 61, right off 61. And there have been kind of some behind, there was an encampment at one time behind where City Station is now, kind of down in the
Mhm.
woods down behind there. I haven't been down there and seen that.
Yeah,
We-
some of those I know have been cleaned out by the police. That's why I
That's
was
gone.
asking if you knew of any other ones that we didn't know.
there was a huge one behind Dunkin' Donut, behind those hotels there.
That's
But
gone.
that's been long gone. They're building a fire station where that was.
Mhm.
Yeah.
I think
Yeah.
one of the points, Denise, you were trying to make is that the police now have been working with other counties to develop policies. They've been working with the DOT to develop policies for eliminating the homeless from the city. So Denise, do you want to say something more about that?
Well, I mean, that's pretty much it, I guess.
it in
is
a
what we
nutshell,
have
huh?
heard. Yeah, I mean, that's it, is the police their job now is to move them out of the city and move them more in the county. So that's why I was asking if you knew of any other new ones that had popped up. I knew about all of these pretty much. We're doing an event for Valentine's Day, and we really wanted to go out. And I was just wondering if you knew of any other ones that might have popped up that we weren't aware of.
It's going to spread outside the city into encampments in the county, it looks like.
Right.
Well, to me, that's not a good idea because there are so less resources for them in the
Sure,
county.
but that's what's happening. I mean, the police are eliminating them. They're putting them in jail and then breaking up their camps. Especially like behind Hampton Inn. They eliminated that one. So
Well, that's what happened to the one.
that's what they're
Sorry.
happening. Go ahead.
Well, and my thing is, I think that we need to get those community and collaborate more to try to help these people that are out there. I get
There is another. I'm sorry, go ahead.
I get the law enforcement side of it as well, because the business don't want them right there at their business. I get it, because in that deters customers, and I get it. I don't know, but I think that we need to help when we can. Miss Gila is going to get y'all's information out to everybody in the meeting as well. so y'all can get some more assistance with what y'all need. But I think we need to see if anybody else has got anything this morning. So I will go through the people on my screen. I will call you as I see you. If I mess up your name, I apologize in advance. Miss Brittany with Tanner, you're the first on my screen, sweetie.
Good morning, guys. I'm Brandy with Willowbrook at Tanner. No huge changes going on right now. I did want to put out there, we do offer the free screening for any individual in need of mental health or substance abuse services. They can call and do that screening over the phone if there's a transportation barrier, or they're welcome to call and schedule a time they can come in, or they can walk in if they are in crisis, or if they cannot wait, we welcome them to walk in for that free screening for substance abuse or mental health. And then we will ensure that they get 3 referrals that best meet their need, that are in their area and accept their insurance. If you need any other information, certainly reach out to me at any time. I'm happy to connect families in need.
Thank you, honey.
Yes, ma'am.
Brittany Berry with the Carrollton City Schools. You're next, please, ma'am.
Good morning, everyone. I am Brittany Berry, one of the school social workers at Carrollton City Schools. I don't have any upcoming information or events, but I'm just here to obtain the information and provide it to our families that are in need. Lee, I did have a question for THS. Should I ask that now or at the end?
You can ask now.
Okay. Guys with THS, just had a quick question in regards to the referral process. Usually I just send my families that are in need of financial assistance or in a motel, just your form. Is that the best way to refer them, or what's the good way to kind of navigate through that process? When I
Well,
do
we do have an online registration process that we are trying to perfect. Gila's been
Okay.
helping us with that. Yes, the registration form, we probably should connect with you to make sure you have the latest version.
Okay.
And we do want to give some sort of priority or consideration to clients that are actively working with other agencies or other programs.
Okay.
So we can talk with you individually. We'd like to see what we would call a warm connection handoff, so that we talk with you about the client that you would like us to support your services
Okay.
by providing our services.
Good
Is
to
that,
know.
Laddie, Denise, do you want to add anything to that?
Yeah, Brittany, if it's something quick, I mean, we're all volunteers.
Yeah.
We do get text very fast. All 3 of us get text on the same text number. We can get calls on the same number. So yeah, if you could text us and then have them fill that form out. They can get the form on our website. We'll send you a link, but that's probably the easiest place, or either Facebook. There's a lot of different places you can get our form, but we'll get with you on that.
I think one of the things we should add is that we typically see folks, or excuse me, we review requests typically on Tuesdays and Wednesdays when we are in our administrative offices. So although we can accept the registration process anytime, we review it and try to make decisions on Tuesday and Wednesdays. There's always exceptions.
As y'all see, Gila is sharing that information on your screen now. If you'll go to the Family Connections webpage, all this is on there, y'all. Gila has worked really hard to get it all set up, and thank God she's a tech genius, because I couldn't have done it. But everything is on there that you need. Find which I don't know what help you need, and just click on click on that on the guide. Anything you need should be there.
It
So
might
thank
be
you.
important to mention that we do look at income and expenses. We're here to help those folks who truly are below the poverty level in terms of their income and needs. That's something we review. And we have a very strong vetting process. So people that are chronically asking that they survive by social services and are not willing to get jobs. We have people that Denise and Laddie can tell you, we have people that say, nope, I'm not willing to get a job. I've always gotten somebody who can help me.
Then
That
you
they're
get no
probably
help.
not good candidates for us.
I agree. I believe in helping those that try to help themselves. So, Miss Whitney Long, you're next on my screen, please, ma'am. There you go.
I'm going maybe if I can figure out how to unmute. Well, I'm Whitney Long. Right. I'm the Assistant Director of Quality Care for Children with the CCR&R with Child Care. We don't really have any updates going on right now, but I did want to let you guys know that the state has started something to where programs who don't quality rate are being allowed to still serve CAP kids, but they are placed on probation. So they're not being closed, but just know that there are some centers that are going through in our area that are on probation, trying their hardest to get these ratings so that they can continue to serve our CAPS kids.
I get it.
Work in
No.
process.
Well,
And
and everybody's so
especially
short. Everybody's so short staffed. Nobody wants
That's
to work.
exactly what I was about to say. And especially in our area right now, a lot of child care centers are just trying to hold on to their teachers. And I know it sounds sad to say that sometimes we need a warm body. Right now, they just need a warm body at times just to stay open. That's being taken into consideration as well with a lot of these programs that are going through probation. So that's it.
Thank you, Miss Whitney. Lisa, you're next on my screen. Lisa Merrill, CMHA.
Well, good morning, everyone. The first thing I'd like to ask is anyone hosting an on the table conversation about the homelessness? Are you, Kathy? Great. I would like more information about that, and also your women's group that you've now started. As far as CMHA and peer support, we have many peer-led support groups. We have the NAMI that meets on Wednesdays at 1 o'clock. Our family group meets on Mondays at 5:30, the first and third Monday. We also now have NA groups and AA groups that meet as well. We have a survivors of suicide loss, if you've lost a friend or a loved one or family member to suicide. Our peer groups are a great way for me to connect with somebody to, and especially our homeless population, they come into the groups. You know, it is so hard for someone to rise up out of homelessness when you're in a daily fight for food, shelter, and clothing.
Mm-hmm.
You know, your big focus is 100% on getting them 3 needs met. So, I mean, I think a shelter is very much needed in our community. And anytime anyone has the opportunity to have a conversation about that with anyone, you know, open that conversation up, and, you know, maybe enough people get talking about it, maybe something will finally get done about it. So I'm looking forward to that conversation, Kathy.
We keep trying. We keep trying. Miss Amanda Buckner, you're next, please, ma'am.
Hi, my name is Amanda Buckner. I serve as a counselor with the Georgia Vocational Rehabilitation Program. We're a program that's federally and state funded, and we are designed to help people with disabilities prepare for, obtain, and maintain employment. So if you do have any individuals that are needing us to support them with possible training and or job placement services, and they have a permanent disability, please feel free to send them my way. I will put the link for the online referral process in the chat and my contact information as well. I can let you know that we have a new supervisor who has started working in this area, so hopefully I'll get to introduce her to Ms. Gonzalez before too long, and she can be a part of this meeting at some point. But she just started today, so that'll be forthcoming. But if anybody has any questions, I'll take those in the chat, or you can let me know of anything.
Thanks, Amanda. If y'all look in the chat, Miss Gila is adding links for the on the table that Lisa asked about. She'll also send all this out in the email when she sends all of the flyers and stuff out from y'all. Next on my screen is Miss Kelly Law. Are you there, sweetie? Your screen's blank. There you go.
Hey, good morning, everyone. I'm Kelly Law, and I'm the other social worker. I work with Brittany Berry at the Carrollton City Schools, and I'm also the Families in Transition Coordinator, which is I help the homeless. So I'm also a homeless liaison. And we currently, as of today, we have 171 students who qualify for McKinney-Vento, which is our homeless program.
Those numbers rise every year, I think, Kelly. Oh, next on my screen is, I believe it's Kevin with Workforce. It just says Works.
Hey, how are you? I noticed that.
It's all good. I figured it out.
Good morning. Good morning. Well, I'm Kevin Williams of WorkSource Georgia, Three Rivers Commission, and I'm the youth work experience coordinator. First time on a call, but my job is to kind of partner up with businesses to try to find work for disadvantaged out of school youth 16 to 24. So yeah, that's primarily just we provide everything, 480 hours. We pay for wages and all that stuff. But yeah, we're just looking for businesses to partner, take a chance on youth to give them that work experience that, if they want to hire them on, they could, or at least give them some type of step up once they enter that career field. So that's kind of what I do.
Thank you. You could help us out over here at DJJ, just saying. Miss
Yes,
Ashley
ma'am.
Powell.
Hey y'all, I am Ashley Nora Powell. I'm a licensed professional counselor and the community relations and education coordinator with Behavioral Health Link Mobile Crisis Services. And we do mobile crisis in the community for mental health, suicidal ideation, psychosis, that sort of thing through the Georgia Crisis and Access Line. And no announcement.
Thank you, ma'am. Thanks for being here. Miss Sailors.
Okay,
We can hear you.
okay. Good morning, everyone. I am Becky Sailors, and I am with Carroll County Schools. And like Kelly, I am the homeless liaison, or families in transition. We call it both. And we currently have 606 homeless students in Carroll County. And with that, a lot of them are what we've already discussed or what we've already heard with homeless. They're doubled up. So thank goodness they're not in the side of the
streets.
But that comes with their own problems because it's an issue of getting into a place and affording the rent and getting out. And then we always worry you're one argument away from being kicked out. So, so thank you for what all of you do.
Thank you, Miss Becky. Lori Thomas with CMHA. You're next on my screen, please, ma'am.
Good morning.
Good morning.
Lisa covered all of our groups and all the stuff that we have on, but I do want to introduce you to, jumping a little bit, to Jean Gordon. She's a new part-time case manager here at Carroll County Mental Health Advocates. She'll be doing a lot of the follow-up with the crisis response team clients and working with our diversion and peer programs as well. So we're excited to have Jean on board.
Way to go, British Jean.
Thank you.
Welcome. She was already a volunteer. That's how I know her. So I'm on the CMHA board. So I've met Jean several times with her.
Yeah, she's probably going to be reaching out to some of you. She's trying to build her resource file so that she has some contacts in the community for the individuals that she'll be working with. So if she gives you a call, please return her call and share information. Thank you.
Thank you. Thanks. Welcome aboard, Jean. Miss Mary Sale, you're next on my screen, please, ma'am.
Okay, Mary Sell, I'm the WIOA coordinator here in Carrollton at West Georgia Technical College. Last Monday, we started the spring semester, so getting the year off with a bang. Currently making sure that the participants in the program and all that they have their necessary books and have all their financial stuff straightened out and all. So anyone that knows dislocated workers or anyone that's looking to gain education, credentials, diplomas, certificates, things like that, just send them our way and we'll see what we can do to help. Thank you.
Thanks, Miss Mary. Miss Bridget Washington.
Good morning, everyone. I am Bridget Washington Collier. I need to change my name. I'm sorry.
It's okay.
I just see it. So I am with Georgia Department of Early Care and Learning. Our agency licenses and monitors childcare programs across the state. And we are most popularly known for our pre-K program and childcare and parent services, our CAPS program. And so if you all are in need of resources for families with young children, please feel free to contact me at any time if you need more information for the families that you serve. And you can also visit our website. I'll put the information in the chat along with our 1-877 All Georgia Kids hotline. When you're looking for specific programs, this is a great resource. For example, I needed a summer camp for basketball for my teenager and was able to use the hotline. So feel free to reach out.
Cool. Thank you, ma'am. Miss Lena Ashton, you're next, please, ma'am.
Good morning. I apologize for my raspy voice. I'm a little bit
This is weather.
Yes, as you can see, all the different variations of temperatures here. But
Yes.
I'm Lana Aston. I am with Peach State Health Plan. I am one of the resource mothers for Planning for Healthy Baby program, as well as doing some postpartum outreach. But I don't have any updates at this time. I serve more as a resource person to look for resources for mothers that have delivered very low birth weight babies and also women that are in their postpartum transition period. But I do want to remind everyone of an update recently with the state for postpartum extension waiver. There it used to be 6 months postpartum for ladies to keep their pregnancy benefits. They are now up to a full year. So that is absolutely amazing, and hopefully it will bring down some of those maternal mortality rates that we have that's so high in Georgia as well as the United States alone. But thank you all. I do appreciate being on here.
And that's nice to know about the maternal benefits. That's great.
Mhm.
Miss Tanika Williams, you're next on my screen, please, ma'am.
Hi guys, my name is Tanika Williams. I am the WIOA Youth Career Facilitator for Carroll and Heard counties. I actually work with Mr. Kevin Williams to provide him with kids young adults ages 16 to 24 who need job experience, paid job experience, educational benefits. We actually have a new program. It's called a Med-Surg program. And basically what they do is we are able to provide the kids with medical certifications such as medical front office assisting. And it's completely free. The laptops are paid for. The actual company will send the participant the laptops. We also have a couple of more programs such as EMT training with Faithful Guardian. We're still working on a company with our CNA programs, but outside of that, we just have so many wonderful resources here. Like I said, for our 16 to 24-year-old out of school youth. So if you need anything, just let me know. I'm here to help. Thanks, guys.
Thank you so much, Ms. Williams. Ms.
You're very
LaShonda
welcome.
Daniel, you're next, please, ma'am.
All right, good morning, everyone. My name is LaShonda Daniel, and I'm with Mercer School of Medicine. I'm a health equity navigator, and I am replacing, I think you guys worked previously with Devin Porter. So I'll be replacing him and covering Carroll County to address any health disparities or collaborating with you all to do any outreach that you have in the community as it relates to any health disparities. We do partner with other agencies to provide, for example, CORE to provide flu shots and vaccinations and boosters. So I'm happy to be here and collaborating with you all. So if there's anything, I'll put my information in the chat. If there's any way that, or any services that you guys feel like you need from us.
Thank you, ma'am. Ms. Jasmine Colvin.
Good afternoon, well, it's still morning. Good morning, everyone. Pleasure to be here. There we go. with you all. I don't have any specific update, well, just one. But I am Jasmine Coleman from Amer Group, Real Solutions in Healthcare. And again, it is a pleasure to be here with you all. I've had the pleasure to work with a few of you already. Ms. Gila and Brittany Berry and I did a winter warm-up event in December. And it was amazing. So again, very grateful to be on this call and receive all of this information. So I do look forward to more collaborative efforts with Carroll County. So opportunities for that, just keep me in the loop and I will do the same. I actually would like to share a resource event that we are having. It is a virtual event. We're doing a Build Your Community Resource Networking event. Again, it's virtual and I will share the link where we are just inviting our community partners statewide to come on and receive information about Amer Group. And then also it's a networking opportunities for Georgia professionals, nonprofit, government, healthcare, and the education sectors to provide information on our community resource link, which is accessible in the community, where they can go in and find specific resources in their area by zip code across several different platforms and social determinants of health. So again, I will share the community resource link as well as the virtual invitation for our networking event that will take place on January 24th. So thank you all for having me.
Thank you very much. I've got a quick update. The Carroll County Family Connections is currently working on our annual plan, which will include more youth mental health awareness as well as education. Our Mental Health Looks Like Me campaign needs everyone who's willing to do a short video or written paragraph with a picture or art that reflects on feelings. Anything to be added to our social media to bring awareness to mental health and the importance of speaking about it. I will say these girls at the high school are doing it, man. We had 2 floats in the Christmas parade. I got to ride on one of those. These girls are getting this done. Gracie talks all the time to everybody. She's involved in a lot of different stuff, not just community-wide, but statewide. This little girl is a firecracker. And it's all about youth mental health. And the more I think we let these kids know they're not alone with the issues that they have, the more they're going to share, the more they're going to reach out to others. And I think that's extremely important. Please, if you have any flyers or announcements, please send them to Gila before the 20th by noon, which is Friday. And then she'll get all that out next week for everybody. Everybody that is on this call, if you're signed up with Gila for an email, if you're not registered with Gila, please send her an email so you can get in the little loop of this, so you can get all the information that you need. I thank everybody for coming this morning. We are very fortunate to have everybody. Our next meeting is February the 21st at 9 a.m. So does anybody have anything else? Ms. Gila, you good?
Yeah, I actually just want to make sure that everybody that has a report from the schools or anything that you need reporting, please send it my way. And we were asking about the dropout rates. If anybody from the schools can give us a report next time on the dropout rate. And also, I don't know what I was going to say. That's it. If you have not registered to be a part of the collaborative, please let us know. Send me an email and I'll add you. And if you receive our e-newsletter, please do open it and see. I also will put everything together that we have in our chat. So if you have not sent us information that you want to go into the e-newsletter or to the collaborative email that I'm going to be sending, please send it my way. My email is there. If anything else, thank you, because we would not be able to do everything that we're able to do in our communities without each of you. Remember, on the table, that conversation of poverty is imperative that we continue that conversation. I think that THS and Impact West Georgia gave us a lot of information today. We already knew some of it, but in reality, our dream is to be able to I have talked to both of these amazing ladies, and I think that the vision to Carroll County, West Georgia area is to be able to have a shelter that is readily available, and especially for those that have not that do not have that opportunity. So please do attend on the table conversations, because those are the ones that are going to be changing what is coming up for Carroll County. Please.
Again, thank everyone for coming. Y'all enjoy the rest of your day. Try to stay dry. It's nasty out there. Y'all have a good day, and we'll see you next month. Thank you so much.
Thank you.
Thank you.
Bye-bye.
Thank you. Bye-bye.